All right, within this module, we're going to be talking about reviewing procedures and prior session documentation. This content within this module is beyond the 2nd edition RBT task list, as well as the more recent 3rd edition content outline. Wanted to bring up that Benjamin Franklin quote again: by failing to prepare, you're preparing to fail, and remind you of those 3 categories we're going to discuss a bit further within this module. And here we're really going to be focusing on, like I said previously, reviewing procedures and prior session documentation. So to dive into those procedures, these could really be divided into 2 different categories that you're likely to see that you need to review, and that's skill acquisition programs and then behavior intervention plan. So skill acquisition programs, how many you might have will vary per client depending on how many goals they have, how much time they spend in ABA therapy per week. This may differ per clients, but you will have to review all of those different skill acquisition programs and kind of know the current phase of the program your client is on, as well as future phases of the program, and if you need to move kind of beyond where they're at currently. And then the second piece is behavior intervention plans, which is typically for challenging behavior, and they consist of usually proactive plans and then reactive procedures in case challenging behavior does occur. And so you'll need to review both of those types of procedures. So we'll dive into each a bit more and talk about skill acquisition plans in a little bit more depth here and what they might look like. So typically within a skill acquisition program or plan or procedure, you're going to have that title of the program up at the top, something that your supervisor may refer to it as. It might be functional communication training, turn taking, nonverbal imitation, things like that. And then within that, you're going to have a specific target skill or skills that your client will be working on. So depending on their age or skill level, you're going to have specific target skills that you're going to need to teach to your client. And those will be listed usually under the title of the program. You might have phases of the program available to you as well, noting where your client is currently, where those target skills fall within the phases of the program. So where are they on phase 2 or phase 3, phase 5 of the skills you might be needing to teach them. And then it's always good to review previous and then future phases of that program as well, in case you need to kind of move back if they're not succeeding at the current level, or move forward if they're kind of breezing through programs as well. Within that skill acquisition procedure, you are going to have specific teaching procedures usually outlined, or how to teach the skill. Are you going to be teaching it through, naturalistic instruction strategies, discrete trial teaching strategies? Is it taught within a group? Is it, taught one-on-one? What kind of prompting procedures are going to be used? What kind of reinforcement schedules are going to be used, or reinforcement procedures? Are you going to be using, a token board within, this program? Are you going to be reinforcing every instance of a certain target skill or behavior, or are you kind of fading that reinforcement out? All of that will also be outlined within a skill acquisition program as well. Often there's going to be some data collection plan written for this plan as well. So your supervisor will note, how data will be collected for this program, what method are you using, and then how often data should be collected as well. And then finally, some type of reinforcers used during the program might be noted as well by your supervisor, or the reinforcement procedures. So like I said, it could be using something like a token board, or just praise as a reinforcer. It could be using certain specific items or materials, and this will also be noted within that program. So to dive into some examples of what these might look like, this is pulled from our book titled The Autism Partnership Method, Social Skills Groups. And here it is for a program about turn taking. So here you can see the goal at the top. You see some example objectives as well. You can see what types of prerequisites there are for the skill, the data collection mentioned there, and what type of teaching methodology or strategy should be used for this program. And so that's at the top, and then a little bit below are that phases of the program for turn taking. And you can see quite a bit of information there. And then there's a second page with more phases of that program. So phase 2 and phase 3, and then some strategies for generalization as well for this program of turn taking. And so this this is just one example of what a skill acquisition program might look like. This will definitely, vary depending on who your supervisor is, what curriculum is being used, and so it'll vary, but you can see some of those common sections or kind of components that I talked about on the previous slide, all present here as well. Here's another example, also from one of our books written by Drs. Ron Leaf and John McCacken, A Work in Progress, and here is nonverbal imitation. Again, you can see the program objectives there, and then procedures below that. And then it has, some prompting strategies, prerequisite skills or entry criteria, mastery criteria as well, and then into those phases again. So you can see phase 1, moving on to phase 2. This one has quite a bit, so phase 3, phase 4, phase 5, and then so on and so on. So quite a bit of, advancing the program for nonverbal imitation. There's quite a lot of phases throughout this program to, going from, kind of relatively simple skills within the program to more advanced complex repertoire of nonverbal imitation. All right, to get into that second procedure here that you might need to review is a behavior intervention plan. Again, the formatting, will likely vary depending on your supervisor, your BCBA, your agency you're working for, or school, but they're likely to have all of these components that you will need to review. So first is the challenging behavior or behaviors of interest. Often they will have a very specific operational definition for what constitutes this challenging behavior. It'll also likely have some sort of title or shorthand like aggression, elopement, self-injurious behavior, but you're going to have more information beyond just that title to know what it looks like exactly for your client. So what is aggression to the specific person, client you're working with? What does that constitute? What does that look like? And same with, things like self-injurious behavior. They're going to be specific for your client, and so they will have an operational definition in addition to that kind of simple title. Within a behavior intervention plan, often the function or functions of behavior will also be noted. So what, in the past has served as a reinforcer for that challenging behavior? Has it been attention? Has it been escape from task demands? Has it been, tangible items, access to those? It'll all be listed there as well, so you'll likely have an understanding of what the typical function or functions of behavior have been in the past. It'll also have a place where you will know what the replacement behavior is for that challenging behavior. So this gets into, kind of that proactive plan, what you're trying to reinforce and replace that challenging behavior with. What is that replacement behavior? Often this comes in the form of some sort of functional communication or functional communicative response, and you'll know what that is. So if it's a simple phrase or, giving someone a peck, a picture exchange, or if they're using an AAC device, it might be using a specific phrase or button within that AAC device as well. But you're going to have a replacement behavior that you're intending to reinforce in place of that challenging behavior, and that will be part of that proactive plan. The proactive plan could be, more than that as well, but typically it does involve some sort of functional communication training, but all of that will also be outlined in that proactive plan. Within the behavior intervention plan, there's also going to be a reactive strategy or plan as well. So what happens if the child elopes, from the setting? What if there wasn't an opportunity to prompt that replacement behavior, or the child did not engage in that replacement behavior, and your proactive plan is kind of out the window at this point? The challenging behavior has occurred. Now what is the reactive strategy? And this will be really important for you to review and be familiar with, because it can happen, and so it's important to know what that reactive plan is and how you can safely manage your client and yourself in those situations as well. This kind of relates to the function of behavior as well, but there's often going to be noted reinforcers. Sometimes these differ from the actual reinforcer that has been previously noted as reinforcing the challenging behavior, attention, escape, tangibles, things like that. It could be something different. It could just be good information to know, like what generally serves as reinforcers for your client, but that will also be noted as well. And then again, similar to that skill acquisition plan, there's going to be a space for data collection and how you should collect data on that replacement behavior, as well as that challenging behavior that you might see throughout your session as well. Okay, now getting into the second section here of types of things you might need to review, and that is prior documentation. This can really be divided into 3 different sections, and we're going to start with session notes. So here, it might be important to review previous session notes. Maybe read your own previous session notes as well as others on the team. This will really help provide some insight as to where the client left off with certain programs in previous sessions, any successes within previous sessions, any potential issues that arose within previous sessions will all be noted in those session notes. And so it's really important to review that documentation in order to prepare yourself to effectively deliver services. The second area of, prior documentation you might need to review are any notes from supervisors. So sometimes this might be on those skill acquisition programs or behavior intervention plans. There might be updates from your supervisor. There also might be some notes like within session notes that you or your other people on your team may have written. There might be some comments or notes from your supervisor, and it might be really important to review those updates from your supervisor. They might be providing more guidance on certain programs or on the behavior intervention plan, some tips, things like that. Often supervisors are very busy with lots of clients and also lots of RBTs on a team, and so they will supervise you regularly, but you might have not seen them the previous session specifically. So sometimes it's really nice to be able to review notes from supervisor that they may have given to other members of the team, and so you can be updated without being seen by your supervisor the exact prior session. And then the last area that you might need to review in terms of prior documentation is any graphs. I really love to take a look at the data. I am a researcher, so I feel like it comes with the territory, but I think they can provide you with a little bit more insight than sometimes session notes can. Certainly session notes can give you a description of certain things more than a graph, but I love looking at graphs for certain trends in the data that we've talked about in previous modules here. Is the behavior increasing? Is it decreasing? Is it variable? Is it stable? Have they kind of stalled in progress? I think it's really nice to be able to look at the graphs and see where the data was in previous sessions, especially if the previous session wasn't with you, it was with somebody else. What did it look like? What did the skills that they're trying to learn and acquire, what did it look like with them? Are they close to mastering a skill? Things like that I think are really nice to take a look at. Thank you, and that concludes this module reviewing previous documentation and your procedures for your session.